बेनिफिट उसकी जस्टिफाइबल हो। हमारे पास जो मरीज आते हैं उनके लिए सबसे उपयुक्त क्या है, योर ICU शुड बी कस्टमाइज्ड अकॉर्डिंग टू दैट। तो यू शुड वर्क ऑन अ प्रपोजल ऑन दीज लाइन्स। इसके अलावा मेरा ध्यान पंक्ति में खड़े आखिरी व्यक्ति पर जाता है। हियर एपिलेप्सी कम्स टू माई माइंड। As Dr. Ayush Dubey had spoken just now, we have a huge load of patients. The society loses so many working hands. The productivity reduces. Young men and women are forced to skip education and work. Taboos are still associated. I feel sorry for the young brides who are thrown away from their homes because they had a seizure or they were caught quietly taking medicines. Public education campaigns should be conducted, making good handouts for epilepsy. Public campaigns again are very, very important for epilepsy. You should also have good handouts for, say, other diseases, migraine, stroke, which are quite common. Also, I would suggest try to build a series of patients. You have a big inflow of patients. For example, when COVID started, all of us were receiving lots of infranuclear facial palsy patients. We should have built a series on that. Now a series was reported, but that was reported about a year after this thing had happened. That too from Mumbai. There's a place called Pachor nearby from Bhopal. Almost every alternate patient from Pachor who comes to neurology OPD will be a patient of neurocystic sarcosis. It is so very rampant. If we have a series, we can report the thing to the government, to the public health engineering departments also. A series would also be an indicator of the volume of work we do. On a personal level, I'd like to share with you, I regret not doing so, because for years I used to work from 8 a.m. to 2 a.m. Not 2 p.m., 8 a.m. to 2 a.m. This was what I was working for years together. I used to see hundreds, not 100, hundreds patients per day. I still see lots of patients and I refuse the same number. जितना देखता हूँ तो वापस करता हूँ कुछ. Had I maintained a series, I could have claimed to have seen the maximum number of neurology patients in history had I maintained a series. You have such a good department, you have such a good inflow. आपको आज नहीं मालूम है कि 10 साल 12 साल बाद आप कहाँ जा चुके होंगे, तो उस वक्त लगेगा उस वक्त का डेटा क्यों नहीं हम लोगों ने इकट्ठा किया. जैसे आज आई रिग्रेट, तो देयर इज नो वे फॉर मी टू रिट्रीव, तो उस वक्त रिट्रीव नहीं कर पाता. This was something when we had an interaction with the faculty some time back, somebody raised this topic, and this is a very important and a very logical thing. इसके साथ ही एक और चीज़ मैं जोड़ना चाहूँगा, अगेन नॉट कंसर्निंग, इट मस्ट हैव कम टू समबडी एवरीबडीज माइंड के दिस के लाइक आई एम क्वाइट बिजी, आई हैव टू सी लॉट्स ऑफ पेशेंट्स. तो हाउ वुड ही मतलब how would what would be the amount of time I would be devoting at AIIMS? The fact is, AIIMS is my priority and I'm available all 24 hours, 7 days a week, 365 days a year for AIIMS, because this is my priority. Next, just a small word on GB syndrome. Now, GB syndrome is a fairly common disease. Over here, the cost factor in treatment is immense. When we offer immunoglobulins, the patient gets it. The price the patient has to pay is in lakhs. I would suggest revisiting some of the studies. Like there's a study which is going on GP pumps since long, which was initiated by Professor M. Mendiratta, IVIG versus plasma exchange, and Dr. Neeraj would guide us on Dr. Kameshwar Prasad's study at AIIMS, IVIG versus plasma exchange versus methylprednisolone versus nothing. So we'd like to revisit those studies and then strategize how are we going to approach patients of GB syndrome. Next, there is something which is not directly related to today's function, but I feel it's very important. Now, the hospital inflow has increased by leaps and bounds under the able leadership of Professor Ajay Singh Ji, our director. On Monday, I believe we recorded a footfall of 4,443 patients, the highest ever. The institute is blooming in accordance to the mandate accorded to it. Accordingly, we will all compliment his efforts. The radiology department under Professor Ayush Malik is a fine department, is doing its best. And I have the department's word that they will stretch to the limit to accommodate as many patients as possible, especially for radiological investigations. I fully agree with what Professor Ajay Singh had mentioned just now. I'll just speak a minute on that. I call upon the neurology department to make a start for something very important. Let us be very judicious while requisitioning investigations. जांच की जहाँ ज़रूरत हो ज़रूर कराए, जहाँ ज़रूरत ना हो कतई ना कराए. I'm carrying a discharge summary with me. After this meeting, I'll request both the faculties to sit with me and the director for 5 minutes. So that discharge summary in itself, it augments what I'm speaking. Investigations should be prescribed only when required and very judiciously. Ours is a training center, a teaching center and a treating center. Let diagnostics be only a part of the treatment. This is all what I had to say, and very soon we'll plan out a roadmap to create a center of excellence in neurosciences. And with this, I end my talk. Thank you very much. Jai Hind.